Msnbc Conversation, Republican from Texas. And Senator, it's a pleasure to have you. I know that you have a set of talking points and a legislative agenda on health care that goes to state-level insurance exchanges. In brief, tell us what you would be in favor of and how it relates to some of the amendments, particularly the Wyden Choice Amendment, and whether that would allow the type of exchanges that you would want.
Well, I do think exchanges that do not cost the government and therefore require taxes of employers or individuals are the way to go. And states can do this without a federal mandate. This is something that I'm promoting at the state level, where it would give employees a choice. They would own their own policy. It would be portable, and employers would find it much less expensive in not having administrative costs and a real factor in their expense levels. So I think that there is something really good there, but not the big government co-op type thing where you have subsidies and therefore costs.
Yeah, I mean, the trick, as I've been learning about this as a journalist, Senator, what really strikes me is some of the just anti-competitive aspects of the current structure, the lack of choice for employees and patients and portability, the antitrust exemption, things that would strike me as low-hanging fruit. Do you get the sense that our congressional body is ready to engage the low-hanging fruit, even if it means an updating of the status quo?
I would love to see a bipartisan effort at taking some of those key areas that everyone would agree on and passing something like that. I haven't seen that in the Senate Finance to be marked up bill, and certainly the House bill was not it. I'm very worried about this public option, which I think would be devastating. And in the House bill, they make hospitals and healthcare providers pay for most of this. Employers would be taxed. I think we've got to get that all off the table if we're going to talk about reform in health care that would really help people have affordable access to health care coverage.
Ezra.
You mentioned a moment ago that one of your problems with the bill is the subsidies, and I know you're running for governor in Texas, and uninsured rates there are above 20%. If you're not going to help those folks through subsidies, sort of what's your idea for getting those people into the coverage network?
Yes, absolutely. I think we do need more insurance, and Texas has the highest rate of uninsured in the country. That's not acceptable. What I want to do is make it affordable for employers to give access to health care to their employees. That's why I like the health care exchange
so
that Utah is doing to great extent. Utah is doing this with great success because employers would then be able to give their subsidy, their $200 a month or $300 a month that they now do as their share of a covered group. They would give that to the employee. The employee would pick the best from this exchange, which would have more benefit of a higher risk pool, which brings down costs, and they would be able to even share it if it's a two-income family.
Where, Senator, I know we all have to sort of wrap this up, but where do we get the greatest resistance in our Congress from the most basic aspects that would liberate choice and freedom for employees, for patients, for doctors, and yield the competitive spirit that America is known for?
Well, I think the majority in Congress has put forward a bill in both houses that will not allow choice. I think if we see that that goes down and we can then start with some of these newer ideas that are not big government takeovers and they're not big subsidized co-ops, but instead let the free market work, that's when I think you would find success, and the president hopefully would adopt that and find success as well.
And then to that end, once you've got an efficient and updated system, you can come back for a taxpayer debate for subsidizing those who can't afford health care even in the most efficient system, correct?
Well, of course, you're still going to have a Medicaid for your less fortunate people who can't afford anything and don't have any access to coverage, and you have the CHIP program, you have Medicare. I mean, that can be made more efficient and certainly more usable, but for the people who have the ability to have insurance, but it's just not quite affordable, I think we can do a lot without a big government takeover.
Yeah, again, competition goes a long way. Thank you, Senator. That and some employee choice will be good to go. Contessa, what's going on?
Hey, Dylan,